As a patient education manager, I have a variety of resources at my fingertips. Some of these are resources that I have helped develop in response to the families and advocacy groups that we've worked with, identifying needs for what kind of information is going to be helpful for families. These are webinars. Sometimes these can be in-person events where either a patient education manager is speaking or one of the healthcare providers that we partner with is speaking. This can look like one of the kits that we can provide to families that when we meet them in person or we can mail to them. These kits have a variety of information in them, some of which is specific to treatment with Koselugo. Outside of Alexion resources and very connected with local and national advocacy groups. And so I can share with folks the types of events and educational programs that are happening in their area. So that can be an excellent resource as they try to get connected with their community. And finally, I can talk to them about the different centers that I have visited and that I interact with who treat families with NF type 1 and give them an idea of the different types of specialists they may see and the kinds of questions from those specialists that can be helpful.
I think it's important for caregivers and patients with NF1 PN to have a strong support system. And what does that look like? Well, it can look like a lot of different things. First of all, it might start with your family. If you've already discussed this with your family, then they can be there to support you as well. It could be sometimes other people in your family, like grandparents. We can help you start to build that support group, that group of people across many different areas, like maybe it's your family, maybe it's a patient advocacy group eventually. But we can just kind of meet you where you are. That's the important thing. And kind of help understand and learn what your family needs at that particular point in time. And as you go through scheduling appointments with the many different specialties, you'll have some people to help you along the way. And your PEM can be there during that whole process. A caregiver or a patient with NF1 PN can find their local patient education manager very easily by going to koselugo.com. Many of the patient advocacy groups have our PEM cards and they know how to reach us. We have very good relationships with all of the advocacy groups across the country. And then finally, your healthcare provider many times has our PEM cards in the office. Feel free to reach out to us at any time, and we'll get back with you as soon as we can.
Indication and important safety information for Koselugo. Indication. What is Koselugo? Koselugo is a prescription medicine that is used to treat adults and children 1 year of age and older with neurofibromatosis type 1, NF1, who have plexiform neurofibromas that cause symptoms and cannot be completely removed by surgery. It is not known if Koselugo is safe and effective in children under 1 year of age. Important safety information. What are the possible side effects of Koselugo? Koselugo may cause serious side effects, including heart problems. Koselugo can lower the amount of blood pumped by your heart, which can be severe. Your healthcare provider will do tests before and during treatment to check how well your heart is working. Tell your healthcare provider right away if you get any of the following signs or symptoms: persistent coughing or wheezing, shortness of breath, swelling of your ankles and feet, tiredness, increased heart rate. Eye problems. Koselugo can cause eye problems that can lead to blindness. Your healthcare provider will check your vision before and during treatment. Tell your healthcare provider right away if you get new or worsening vision changes, including blurred vision, loss of vision, dark spots in your vision, floaters, other changes to your vision. Stomach, intestine, and mouth, gastrointestinal problems. Koselugo can cause diarrhea, vomiting, nausea, and mouth sores. Diarrhea can be severe with Koselugo. Tell your healthcare provider right away the first time that you get diarrhea during treatment. Your healthcare provider may give you medicine to help control your diarrhea and may tell you to drink more fluids. Skin problems. Koselugo can cause severe skin rashes. Tell your healthcare provider if you get any of the following signs of skin problems: rash that covers a large area of your body, flat skin rash, raised bumps on your skin bumps that look like acne, blisters, peeling skin, itchy rash, hair thinning or hair loss, alopecia. Increased level of an enzyme called creatine phosphokinase, CPK, in your blood, and muscle problems. Koselugo can cause severe muscle problems. Treatment with Koselugo may increase the level of an enzyme in your blood called creatine phosphokinase, CPK, which may be a sign of muscle damage. Increased level of CPK in the blood is common during treatment and can also be severe. Your healthcare provider should do a blood test to check your blood levels of CPK before you start taking Koselugo and during treatment. Tell your healthcare provider right away if you get any of the following signs or symptoms: muscle aches or pain, muscle spasms and weakness, dark reddish urine. Your healthcare provider may change your dose, temporarily stop, or permanently ask you to stop taking Koselugo if you have any of these side effects. Before taking Koselugo, tell your healthcare provider about all your medical conditions, including if you have heart problems, have eye problems, have liver problems, females who are able to become pregnant. Your healthcare provider should check to see if you are pregnant before you begin treatment. You should use effective birth control, contraception during treatment and for 1 week after your last dose. Tell your healthcare provider right away if you become pregnant or think you may be pregnant during treatment. Males with female partners who are able to become pregnant. You should use effective birth control, contraception during treatment and for 1 week after your last dose. Are breastfeeding or plan to breastfeed. It is not known if Koselugo passes into your breast milk. Do not breastfeed during treatment and for 1 week after your last dose. Talk to your healthcare provider about the best way to feed your baby during this time. Tell your healthcare provider about all the medicines you take, including prescription, over-the-counter medicines, vitamins, or herbal supplements. Certain medicines may affect the way Koselugo works. Especially tell your healthcare provider if you are taking a supplement containing vitamin E, aspirin, blood thinners, or other medicines to treat blood clots. Koselugo capsules contain vitamin E, which may increase risk of bleeding. What should I avoid while taking Koselugo? Avoid St. John's wort, grapefruit or grapefruit juice, and Seville oranges during treatment. Most common side effects in children include vomiting, diarrhea, increased level of an enzyme called creatine phosphokinase, CPK, in your blood, dry skin, redness around the fingernails, nausea, skin bumps that look like acne, fever. Most common side effects in adults include rash, diarrhea, skin bumps that look like acne. These are not all the possible side effects of Koselugo. Call your healthcare provider for medical advice about side effects. You may report side effects to AstraZeneca at 1-800-236-9933 or at https://us-aereporting.astrazeneca.com or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see patient information and instructions for use in the full prescribing information for Koselugo, selumetinib, or at https://alexion.com/documents/Koselugo_USPI.pdf.